Hello, I'm Don Nystrom. Our program right now that you're about to listen to, hopefully, is on human services in Wood County. And we are fortunate to have the Director of Human Services here in the studio. And I think if you stay tuned, you're going to find out a lot you may not have known about the various services provided to the residents of Wood County through the Human Services, which many years ago was called Social Services, right?
Mm-hmm. Yeah, we had two different departments, Unified Services, which handled the mental health side, and Social Services was the child welfare and economic assistance side.
And now it's been combined into
Yep.
Human Services. And so Brandon Vruwink is, of course, the administrator, or is that your title?
Director.
Director of Human Services. You have the largest budget in Wood County.
Yeah.
Like how much?
Our budget is $40 million for our department. The county budget, I think, is around 110 or so. So we take a big chunk of the county budget.
Wow. Now, is that all local tax dollars, that revenue number you mentioned? Is it, or is that, some of it obviously comes from other sources?
Yeah.
State and so forth.
Yeah, we have a mix. About 28% of our funding is local county tax dollars, so local county tax levy. And the rest of it comes from state, federal sources and insurance payments that we get for folks that receive services from us.
Okay.
Medicare, Medicaid, state block grants, federal block grants. So quite a mix of service dollars that come in.
Maybe you could just describe, I know there's a whole lot of departments in there. Actually, I was on that board at one time many years ago, late 80s, but I'm sure it's changed. What kind of services do you provide? What are your departments that you are responsible for?
So in that $40 million budget, we have two healthcare facilities. We have Norwood Health Center, which is part of our department.
Mm-hmm.
We also have Edgewater Haven Nursing Home, which is part of our department.
Okay.
Edgewater Haven Nursing Home became part of the Human Services Department in June. It'll be 2 years. So a recent change the county made. Edgewater Haven used to be a standalone facility. The county made a decision that since we have one nursing home license, which is Norwood Health Center, in the department, that it made sense for us to bring Edgewater Haven under our department. The idea behind it is that we needed to have more collaboration between Norwood Health Center and Edgewater Haven.
Okay.
And also the fact that there's a collaboration that goes on from our community program side with having residents that are sometimes in need of protection that get placed at Edgewater Haven, and that becomes their long-term home. So there's a lot of collaboration that becomes between all of our different divisions within our department.
Sure. Okay. Other departments you have?
Yeah, so those are two certainly big standalone facilities. We also operate what we call our traditional human service programs. And those programs consist of our child welfare services, and our youth justice services. So in that area, we get reports of child abuse and neglect, which we are required to investigate. So we investigate those concerns. Unfortunately, sometimes it leads to us having to remove children from their homes to make sure that they're in a safe place.
Sadly.
It's a very sad situation. Our long-term goal always is to reunify those children with their parents, so long as we determine that the environment becomes safe for them.
Okay, let me just not go into detail on that, but we see news stories, unfortunately, frequently on child abuse. And it's tragic, to hear any story like that. But the process is, if the law enforcement is called to a situation, domestic or otherwise, how does the child get put someplace protectively? What's the process for that?
So the process for that is our social worker has to make a determination. So a social worker that comes out, goes into the home, makes a determination on whether the environment's safe or not. For instance, if you have, which we've seen more of, a drug situation in a home where law enforcement's involved, obviously it's not going to be a safe home environment for that child. So we have the authority as a department to take the child and put them in a safe environment. There becomes court proceedings that would occur after that.
Sure.
But certainly in emergency situations, we have the ability to take children from the home, place them with a caring relative, or if we can't find someone that's a caring relative, we would place them in foster care.
a grandma or grandpa's or
Yeah.
aunts or uncles.
Yeah.
If you make the call.
Yeah.
But do you have potential foster parents available 24/7?
We do.
You do.
Yeah. We have foster parents that take phone calls at all hours. We always have a great need for more. We have a tremendous group of foster parents that have big hearts, that have opened up their homes to children for many, many years. In fact, we just had our foster care summer picnic a couple nights ago, and it was such a joy to see little ones running around with smiles on their face, and caring foster parents that are truly foster parents because they care.
Yeah.
And but there is such a need. So anybody that is listening to this program, if you know of someone that has been considering becoming a foster parent, please reach out to our department. We always have a need for folks that are interested in opening up their homes and providing care to children.
Yeah, the foster parents are a godsend. They could save a child's life.
Absolutely. And
give nurturing that probably isn't being given to
Mhm.
them by their maternal parents. So I agree with you 100%. If anybody out there thinks that they might qualify to help some little kid out, let the department know, and they'll explain the process. There is reimbursement for it, but that's not the reason that people do it.
Yeah, it's absolutely not. It's there is reimbursement. We support the costs when people are foster parents, but yeah, the reimbursement certainly isn't the reason why anybody becomes a foster
It's
parent.
because you love kids.
Yes.
And they need help. So other departments.
Yeah, so also within that area, we have our youth justice unit, which provides services to youth that may be getting in trouble. So it might be a referral that we get where a youth was caught stealing something from Walmart. And so they don't go to jail, but we have a program where we work with them and counsel them. And hopefully that we're able to help them change their thought process so they don't have more behaviors like that. That would be a smaller type situation. But we do work with kids that are truant from school. So if we get a truancy referral where a child has been missing school for a number of days, the school will let us know. I think the number is 10 days. We get a referral, and then we have to work with that child to figure out why they're not going to school, how we can help them start going to school, and work on some of those barriers so they get back on track.
Okay, social workers are the ones who connect.
Yeah.
I assume they work with the parents also, who may be frustrated.
Yeah.
That they thought their child was going to school and didn't.
Yes. And so one of the bright spots in that area is we've developed a youth mentor program. And it's brand new, just started this year. And I'm very thankful to the Health and Human Services Committee and the County Board for supporting that initiative. We hired a youth mentor that is working with kids now and developing positive relationships, doing activities with them, helping them get ready to transition out of foster care if they're in foster care. So we found that that's providing a good level of support, and that programming works. So that's something that we want to continue to highlight, continue to grow, because we know if we invest in kids and provide support to them long term, it's going to provide a much better life for them. And frankly, it's going to save resources for other kids that need them.
So the social worker might, for example, suggest big brothers, big sisters.
Yeah. And
something like that.
And
to
take
say,
on a
why don't
role
we,
like that.
if they're being bullied, that might be one of the reasons they don't go to school. So I assume your social workers would work also with
Absolutely.
the schools.
Yeah, we work very closely with the schools. We get referrals from the schools on concerns. Schools will call us up if they know that we're working with the child and say, hey, this child's had an outburst. Can you come to school and help us with that? The ultimate goal is to help maintain a child at school so they're not thrown out of school for behaviors. So it is a lot of collaborative work that's necessary for us to have success.
Well, I wasn't familiar you had that program. You probably have others I don't know anything about. Tell me about some of the others.
So that kind of covers our Child Welfare Family Services area. Then we move into our Community Resources Division, and our department is rather unique because we provide services in a program called our Food Share Employment and Training Program. And that program provides services to folks that are receiving food share benefits. A lot of folks know food share as food stamps. So it's a program designed for folks age 18 to 49 that are receiving food share benefits that are either unemployed or underemployed. The folks 18 to 49 without children are primarily referred to our program, but anybody receiving food share from age 16 till 85, if they want to, can volunteer for services in that program, which means they can get services. And the program design is to help someone that, say, is out of work, looking for a job. We help with resume development. We help with job leads, applying for jobs. We help with writing cover letters. We help with organizing what they want to do. If someone wants to, say, change careers and become a CNA, and we sure know that there's a great need for CNAs, we can help pay for that education. So the CNA course being a 6-week course, we have funding that allows us to help someone get through the CNA class, and we'll pay for that. Once they graduate from that program, we can buy scrubs for them so they can start a job. We can buy all the uniforms they need to start, and we can help them with gas until they get their first full paycheck. So that program does great wonders for a lot of folks.
That's fairly new, is it?
So it's a program that's been around but became a regionalized program in 2014. So it used to be a smaller program, and each county provided services in the program. But in 2014, it became a regional program, and most counties got out of the business of providing it. So Wood County actually provides services in 9 counties.
Really?
Yes. So we have a regional model where we provide services from Adams County all the way up to Vilas County. And we don't have Wood County employees providing the services in all of those counties. We have Wood County employees in Portage County, Adams County, and Wood County.
Really?
And then we have a partnership with a private entity that provides the services in the 6 other counties. But we've seen great success. We've got the highest enrollment numbers in our region of any region in the state. So
there are, I assume, food share clients that live in very rural areas, like City Point.
Absolutely.
And for them to find way to work is got to be really difficult.
Yeah.
So what can you do? I mean, maybe they'd like to.
Absolutely.
But they can't get from here to there.
And that's one of the things that we work on. So we talk about it with all the folks we're working with, is barriers to employment, identifying what those barriers are. So is that barrier transportation? So how do we solve that? We know that transportation is a huge issue, especially if you don't have money coming in.
Right.
And so the question is do you have a neighbor or a friend that would pick you up? If you do, we can help pay for their gas to get you to your appointment. So we can help pay for their gas if they can get you to work. We also can help, if you have a car but it's not running, we can help with some car repairs to help get your car up on the road so you're able to get back and forth to work. So we have flexibility in the program to do a number of things to help eliminate those barriers and get folks to work. And we know that people really want to work. The folks that we're connected with, they really want to work, but there's things in their lives that have really prevented them from being able to do that. And our goal is to help them overcome those barriers so they're able to get back to work.
Well, that's creative and it's progressive.
Yeah, we're really excited about it, and the success stories that we've seen are just incredible and
That's good.
Warm our hearts.
That's good. All right, let's find out something else.
Sure. So we also do in that area, we do traditional programming, such as we take applications for food share, we take applications for Badger Care, applications for child care assistance, and also energy assistance. So we provide support for folks that need help, primarily during the winter season when those heating bills get to be pretty expensive. And I think what a lot of folks don't realize is we provide a lot of services to the elderly in our energy assistance program.
Right.
Folks that are on a fixed income, people are surprised that they are actually eligible for that benefit. But it helps folks that have a fixed income. You know, in the summertime, they're able to do well on their fixed income. But when they see a spike, and you get that weather like we've had, and you're below zero, those heating bills rack up. And a little extra help goes a long ways in helping people stay in their homes.
And that service is available to those qualified individuals right here in Marshfield.
Absolutely. And we have outreach sites that come to Marshfield. So we used to work out of this building and provide an outreach site here.
This is the tall building on Central Avenue that used to be the City Hall.
Yes. So we used to, folks can still pick up applications for energy assistance in this building up on the 4th floor.
Which is where social services has been for many years.
Yes, right across from Pick and Save. So we still provide that service, and we do come up to Marshfield and meet folks one-on-one if they need that. So reach out to our office if you have a need.
Yeah, and that fourth floor location is still going to
We're still going to be here. We
be
plan
here on a lease from the new owners of
Yes.
this building. And then you had mentioned that an earlier program we did
Yep.
that the Wood County Annex is also going to move into this building.
Yeah, the
correct?
folks that are currently located on 4th Street
4th
here in
Street.
Marshfield are going to be moving here by November 1st. So they will occupy the 2nd floor.
Yeah.
Our traditional services that are on the 4th floor right now will remain here. And our plan is to remain here for at least 10 years.
Really?
Yeah, so that's what our commitment is at this point. We're excited about that. We're excited to have both of our programs in one building. To
And
allow
it's downtown.
and it's downtown, and it's
It's, on 4th Street, I'm familiar with CRP Ceramics, I think,
yes,
is out there at the old
Yep.
fire station area. I'm not sure if they moved or not, but it's not downtown.
Yeah.
And some of these people have limited mobility, so to be able to walk up and down the street and go to our new Wenzel Plaza, which is not far
Absolutely.
from here,
Mhm.
this tall building on Central Avenue,
yes.
which doesn't have a name yet. I'm
Mhm.
joking
Yeah,
about
we're
it
referring to it as City Hall Plaza in the moment.
for the moment.
In the moment. So otherwise, a lot of folks say the old City Hall.
Right.
But yeah, it will be.
It'll be great because there's a lot of stuff going on downtown that will give them an opportunity to be mixed with the community.
Yes.
And there are people out there that we all know that are daily. They come and go daily, as I understand
Yep.
it. Right.
Yeah, and the nice thing about our services that are on the 2nd floor, and we're kind of getting to morphing into our behavioral health side, which is great. We have a drop-in center for folks that have mental illness, need help and additional support. So we'll have a drop-in center, which offers an opportunity for folks to get together, converse, and play pool. So we have a pool table for them to do that. We have activities that are organized for them to come in and utilize. Some folks just come in and hang out. They come and meet with their case manager and talk about how things are going in their day. We'll have a little kitchen for them to learn how to cook if they need help with that.
Cool.
We do special days where they come in and we have a pancake day where they can come in and cook pancakes and talk about how things are going on. So that's part of our behavioral health services that'll be coming up the 2nd floor here.
Cool. Okay, let's go on.
And we'll go on to more behavioral health services, and we have an outpatient clinic. We provide services. Our outpatient clinic is primarily Wisconsin Rapids, but we do offer services here in Marshfield as well. And those services right now are at the Wood County Annex and Health Center. We are going to move that over here to 2nd floor. So we'll have all of our folks together in the behavioral health area here on 2nd floor. We also offer services for telepsychiatry that we offer. So we have our Marshfield folks that come in and they're able to meet with a doctor, but it is by telepsychiatry, so by video. Unfortunately, a lot of psychiatry now is moving to that model. It's very hard to attract psychiatry services and get someone in person. So that's the model that we're using both here and in Wisconsin Rapids. But it seems to be working well. Folks get comfortable after a little period of time, and it provides a good service.
That's great.
We do have outpatient therapists that provide outpatient therapy. We're fortunate to have 8 therapists that do that. So we have a pretty healthy number of folks that provide that service. One thing that certainly is evolving is we're seeing more and more behavioral health services in our community. Aspirus in Wisconsin Rapids opened up a behavioral health wing. It's got to be about a year ago. And they're providing services there too. So they are taking a load off of kind of what we have. We don't have a waiting list at this point for services, which is really great news. It means that folks that need to be seen are being seen. So we are meeting the mental health needs in our community. But those needs, kind of ebb and flow too. There can be times when we see more and more patients or folks that have a need. And we never want to turn anybody away because there is such a great need for service.
Oh, for sure. And let's take one more department, then we're going to have to let you get back to your real job. One more department that we may not be real familiar with.
Okay, let me try and think. a service that we provide. We've kind of...
How about the unified services? The one time there was a group home on Airport.
Yeah, so that Airport Avenue group home closed January 1st of 2017.
Okay.
So, but within that group home, we offered our crisis line within that facility. That crisis line actually moved from Wisconsin Rapids up to Marshfield. So the crisis services that are offered are now in the Wood County Annex and Health Center, otherwise known as Norwood Health Center. So we have 2 folks that are working that crisis line, and it's staffed all the time. So county staff are answering that phone 24 hours a day, 365 days a year, which has been a great resource. So when someone's in crisis, they can call our line, and they will be talking to a professional that is able to assist them.
Okay. If someone has a family member who's in a crisis, the first call is to your crisis line or to the law enforcement if somebody's acting inappropriately in a home environment or something.
So if they have concerns that someone is in crisis, they can call our crisis line. They can call our department directly, and we'll have someone that is able to do an assessment as well. But the crisis line can do a triage and get them to the right spot, even if the crisis line isn't the right spot for them. But if they're feeling like it's a crisis, oftentimes we get calls transferred to us from dispatch. So a lot of folks that maybe don't know about the crisis line will call our dispatch line, and dispatch will transfer them to us. And so that works just as well. So it's really a team effort between law enforcement and our department.
Collaboration. Well, it's, the medical center has lines available, nurse hotlines and other things that take care of medical things. But if you have mental health things, that's also available. So we're well covered if people are aware. And like you said, that one group can refer to another group. So if it's a medical call and it really should be your call, I'm sure they work together on
Absolutely. In our philosophy, in our department, there is no wrong door. So if you get a hold of us, we will get you to the right spot.
Absolutely. Well, we only have a few minutes left.
Sure.
What do you see as trends in your business of humans in general? Is it getting better? Is it getting worse because of the drug problems? What do you see?
So, we are seeing the impact of drugs, and that has an impact on families and whether kids can remain in the home. It also has an impact on recovery and how long it will take someone to get treatment and get recovery. There's always a need for more services for AODA issues, and there needs to be patience because recovery can take a long time. So I definitely see a need in that area, and substance use is something that we need to continue to focus on, and we need to continue to try to find really community solutions. So it's going to take everybody to solve this, the issues that we're seeing from law enforcement.
It's a national program, but we're not immune to it.
No.
But it's a additional cost both in human lives as well as financial to the community.
Absolutely. And, when we look at our jail, we have a bunch of folks that are in Wapaka County that we contract for. We also have a contract in Adams County now for 25 beds there, and those 25 beds are filling up.
Wow.
So now we're over capacity, so that tells you that there definitely is some stuff that's going on. But a need that we have really, as I stated earlier, we have a need for more foster parents, and that's a continued need. But there's really an ebb and flow from things, and 1 month you think we're doing better on it, the next month that changes quickly, and we're thinking, gosh, we hope we were doing better.
Constant reassessment.
Of where we're at. So we're constantly trying to shift priorities, shift resources, and that's tough.
The kind of business that you're in is one that's, I would suspect, hard to attract employees because it can be depressing. I assume at time to time the kinds of clients that are needing services. Do you have trouble recruiting, or the county, I assume, probably pays a little better than some of the private facilities that provide services?
I would say where we have trouble recruiting can be in nursing. So nursing, there's been a nursing shortage, CNA shortage, And you have private facilities that are offering large sign-on bonuses for folks and retention bonuses, and that's not something the county does. The county has a nice benefit package, and we try to be competitive on our wages, but the reality is that we're seeing things that we can't compete with now.
Yeah.
There's a facility or hospital opening up, I think, in the Eau Claire area, and they were recruiting for nurses, and they offered a $25,000 sign-on bonus with an agreement that they work there for a certain period of time.
Yeah.
Well, that's not something that we can do.
Right. Yeah,
So,
there's a lot of contract nurses
there are. That is a
who
booming
work
area.
at all of the medical facilities that have the ability to come in, maybe work 3 days and get paid for 4 or 5 or whatever, and the county does not have that flexibility, I assume, because of statutes. It's been really interesting having you out here, Brandon. I've learned a lot about what you're doing down there and the services that you're providing, and there's a whole lot more that we could talk about, but your time is important and you need to get back to work to help serve the human service needs in Wood County, and I hope that maybe some of your department heads can show up here from time to time. We'd really like to get into in depth a little bit about how we can help you help the ones who need help, and I think we're a compassionate county and we want to do the right things for people, and certainly the services you provide are highly respected in the community. So thank you for coming up here and for sharing some of this information with us, and we hope to see you or your staff up here again sometime real soon.
That sounds great. Thank you very much for giving me the time.